Welcome back to the Deep Dive. Today, we're really getting into something important for so many of us pet owners. Diabetes in our dogs and cats. Yeah, we've gone through a whole load of sources you sent over articles, notes, all focusing on, the symptoms, how vets diagnose it, and the treatment for diabetes mellitus. So our goal here is simple. Pull out the absolute must-know info from all that material. We want you to understand what pet diabetes actually is, the signs to watch for, how vets figure it out, and importantly, what managing it really takes day to day. It's about giving you that core knowledge so you might spot it early or just understand the road ahead if your pet ever gets diagnosed.
Right. And the sources really make it clear why this understanding matters so much. It's not trivial, Diabetes has a huge impact on a pet's life, their quality of life, and it definitely requires commitment from the owner, a real partnership. Early detection, as you said, is key. The sources emphasize that again and again. What's also fascinating and comes through in the material is how it mirrors human diabetes in some ways, but diverges in others, especially when you compare dogs and cats.
Okay, let's start there then. Unpack the basics. According to these sources, what's actually happening inside a pet's body with diabetes mellitus?
Well, think of it like a breakdown in how the body handles its main fuel source, sugar or glucose, from food. The sources describe it as an endocrine disorder.
Meaning it's a hormone issue.
Exactly. The big hormone here is insulin. It's made by the pancreas.
And insulin's job is?
It's like a gatekeeper or key, maybe. It lets glucose move from the bloodstream into the body's cells where it's actually used for energy. With diabetes, that system's broken. Either the pancreas isn't making enough insulin, that's sort of the type I situation, or the body's cells are basically ignoring the insulin that is there. That's more like type 2 insulin resistance. Either way, glucose piles up in the blood because it can't get where it needs to go.
Got it. And the sources mention those two types, like in humans, but they tend to show up differently in dogs versus cats, right?
Exactly right. Type I is what we see most often in dogs. This is usually where the immune system itself attacks and destroys those insulin-making cells in the pancreas. So you end up with an absolute lack of insulin. The body just can't make enough, period.
Okay, clear distinction for dogs. What about cats?
Cats more commonly get type 2. This usually starts with insulin resistance. The cells aren't responding properly to the insulin signals, so initially it's more of a relative insulin shortage. The insulin's there, but it's not working effectively. But here's a critical point the sources make for cats. If that type 2 isn't managed well, early on, the pancreas can eventually get overworked trying to compensate, and those insulin cells can just burn out.
So they can become insulin dependent like type I dogs.
Yes, exactly. They can end up needing insulin injections just like a type I diabetic.
That potential for remission in cats, though, if you catch it early, that seems like a really important takeaway from the sources.
It is a huge motivator for early diagnosis and treatment in cats.
Okay, so we understand the mechanism. Now, why does it happen? Why do some pets get it and others don't? The sources listed quite a few risk factors and causes. This feels really key for owners wondering about their own pet's risk.
Absolutely. Understanding the why helps. Genetics plays a role for sure. Certain breeds just pop up more often in the data.
Like which ones?
Well, the sources specifically called out poodles, dachshunds, and beagles for dogs. And for cats, Burmese cats seem to have a higher genetic risk.
Interesting. What else?
Obesity is a major one. Especially, again, in cats, excess body fat contributes directly to that insulin resistance we talked about.
Makes sense. Any other health conditions involved?
Yes, other hormonal issues can increase risk. Things like Cushing's disease in dogs, that's too much cortisol, or a condition called acromegaly in cats, which involves excess growth hormone. Both mess with insulin's effectiveness.
Okay.
Pancreatitis, too. If the pancreas gets inflamed repeatedly, chronically, that can damage the insulin-producing cells over time.
Right, damaging the source.
And even some medications can be a factor. Long-term use of steroids, corticosteroids, or certain hormone drugs called progestogens, those are listed as increasing risk.
Wow, okay. Steroids are pretty common.
They are, and it's something vets weigh carefully. And finally, age and sex play into it. It's generally seen in middle-aged to older pets. And there are slight sex links mentioned. Unspayed female dogs seem to be at higher risk, and for cats, it's neutered males that show up more frequently in the stats.
So you could have, say, an older, slightly overweight, unspayed female beagle, and the risk factors are starting to stack up based on this info.
Exactly. It's often a combination of factors.
Okay, that's really helpful context on who might be more susceptible. Now let's get to the practical side for owners listening. Recognizing the signs. The sources say they can creep up slowly. be subtle at first. What are the absolute key things to look out for?
This is where owners can make a huge difference. The classic signs are often called the 3 Ps: polyuria, polydipsia, and polyphagia. Fancy words, simple meanings.
Okay, break those down. Polyuria.
Increased urination. Because all that extra glucose the body can't use spills over from the blood into the urine when it passes through the kidneys. And glucose acts like a sponge, pulling water with it.
So they pee more volume more often. Maybe accidents in the house.
Exactly, even in well-trained pets. Then there's polydipsia, increased thirst. They're losing all that fluid through urination, so they drink more to try and keep up.
You might notice the water bowl is always empty or they're asking to go out constantly.
Right. And the third P is polyphagia, increased appetite. This one seems counterintuitive sometimes, especially with the next sign.
Why more appetite?
Because even though there's plenty of glucose in the blood, it's not getting into the cells for energy. So on a cellular level, the body is literally starving. It sends signals saying, eat more.
Ah, okay. But despite eating more.
They often lose weight. That's another major sign. Since the cells can't use glucose, the body starts breaking down fat and muscle for energy instead. So increased appetite plus weight loss. Big red flag.
That combination really stands out. Anything else?
Yeah, you might just notice general lethargy. They seem tired, less energy. Their coat, the condition, can suffer. Maybe it looks dull, dry, or brittle. And the sources also point out some specific complications that can be visible signs, too. In dogs, cataracts are really common. Their eyes might look cloudy. This can happen surprisingly fast in diabetic dogs.
Cataracts. Okay. Anything specific for cats?
Yes, cats can develop nerve damage, neuropathy, especially in their hind legs. You might see them walking differently, kind of flat-footed on their back paws with their hocks closer to the ground. It's called a plantigrade stance.
Okay, so increased thirst, peeing, appetite, but losing weight. Plus, maybe lethargy, coat changes, cloudy eyes in dogs, or that weird walk in cats. That cluster of signs really shouts, vet visit.
Absolutely. Don't wait if you see those, especially together.
Right.
And as the sources warn, if you do wait or if it's missed, it can escalate.
Right, you mentioned something more severe.
Yes. Diabetic ketoacidosis, or DKA. This is a genuine life-threatening emergency. It happens when the body, desperate for fuel and unable to use glucose, breaks down fat so rapidly that it produces these toxic byproducts called ketones.
And the signs of DKA.
They're severe. Vomiting, extreme dehydration, just profound weakness, breathing really fast, maybe even collapse or coma. It really highlights why catching those earlier P signs is so critical. It can literally save their life and prevent that crisis.
So you've noticed some signs. You're concerned. You take your pet to the vet. How do they actually pin down the diagnosis? What do the sources say vets do?
Well, it starts like any good investigation with a physical exam and a really detailed history from you, the owner. They'll want to hear all about those changes you've seen, the drinking, peeing, appetite, weight, energy levels.
Gathering the clues.
Yeah.
Then what?
Then come the lab tests. Blood work is key. They're looking for hyperglycemia that's persistently high blood glucose. The sources give some numbers as guidelines. Consistent fasting blood sugar levels over, say, 180 milli-GDL in dogs or maybe 240 milli-GDL in cats are highly suspicious. That mGDL is just the unit of measurement, milligrams per deciliter of blood.
Okay, high blood sugar.
Yeah.
But you mentioned stress can raise it, especially in cats.
Exactly. A stressed cat at the vet clinic can have temporarily high blood sugar that isn't diabetes. That's where another test becomes really valuable, the fructosamine test.
Fructosamine, what does that show?
It gives an average blood glucose reading over the previous 2 to 3 weeks, so it smooths out those temporary spikes from stress or a recent meal. It gives a much better picture of the pet's usual blood sugar control. Very helpful for confirming diabetes, especially in cats.
That makes sense. Get the longer-term picture.
Yeah.
What about urine tests?
Urinalysis is also crucial. Finding glucose in the urine, which is called glucosuria, confirms that the blood sugar has been high enough for long enough to spill over. Normally, there shouldn't be any glucose in urine. And they'll also check for ketones in the urine. Finding ketones, particularly if the pet is also acting sick, is a major warning sign for DKA.
Okay, blood test for high sugar and long-term average, urine test for sugar and ketones. Anything else?
They'll likely run general blood work too, a CBC and chemistry panel. These check things like red and white blood cell counts, kidney function, liver enzymes, helps assess overall health and look for any other problems happening at the same time. Sometimes, depending on the case, they might do imaging like an abdominal ultrasound or x-rays, maybe if they suspect underlying pancreatitis is a trigger or looking for other issues.
So it's really a combination of what the owner sees, the physical exam, and the specific lab tests confirming high glucose over time. All right, diagnosis confirmed. What comes next? Management. The sources describe this as a multi-part approach and definitely a commitment.
It absolutely is a commitment, no question. But, and this is important, it's very doable for most owners. The cornerstone for almost all diabetic pets is going to be insulin therapy.
Injections?
Yes, usually twice daily injections. The sources mention specific types, commonly use things like NPH or Vetsolin, often for dogs, maybe Glargine or Prozinc for cats. The key is consistency. Owners need to learn how to give the injections. They're usually small needles under the skin. Most pets tolerate it really well. And the timing is crucial, giving it at the same times each day, usually linked with meals.
Okay. And you mentioned that hopeful note for cats earlier.
Right, that possibility of remission. It's a key point from the sources for cat owners. With early aggressive treatment, meaning getting the blood sugar controlled quickly with insulin and diet, some cats can actually regain enough pancreas function that they might not need insulin long term.
Wow. But for dogs?
Dogs, unfortunately, almost always need insulin for life once diagnosed with type I.
Okay, insulin is central. What else is involved in management?
Diet is the other huge piece, and it's not one size fits all. For dogs, especially if they're overweight, the sources often recommend diets higher in fiber. Fiber can help slow down how quickly glucose gets absorbed after a meal, leading to smoother blood sugar levels.
Makes sense. And cats?
Cats are different. They're natural carnivores. So for them, the ideal diabetic diet is typically low in carbohydrates and high in protein. This matches their natural metabolic needs much better.
So different dietary strategies for dogs versus cats.
Definitely. But for both, consistency is king. Feeding the same amount of the same food at the same times each day is really important for predictable blood sugar control alongside the insulin. And obviously, avoiding sugary treats is a must.
Consistency in insulin, consistency in food. What about exercise?
Yep, that's the third leg of the stool. Regular moderate exercise is great. It helps improve how sensitive the body's cells are to insulin, so the insulin works better. Plus, it helps with weight management, which is often critical, especially if obesity was a contributing factor.
Okay, insulin, diet, exercise. What about keeping track of how well it's all working? Monitoring.
Monitoring is absolutely essential and ongoing. This is where the owner becomes a key part of the healthcare team. Home monitoring is often encouraged.
Like testing blood sugar at home.
Yes. Owners can learn to use a glucometer similar to human ones, but calibrated for pets to check blood sugar levels. Sometimes vets have owners do a glucose curve, testing the blood sugar every couple of hours over a 12 or 24-hour period at home. This gives a detailed look at how the insulin is working throughout the day.
That sounds involved, but gives real data.
It does. There's also urine testing with dipsticks, checking for glucose and ketones. It's less precise than blood glucose for day-to-day management, but it can provide extra information, especially about ketones. And then regular vet checkups are crucial. They'll likely repeat fructosamine tests periodically to check that long-term control. All this information, the owner's observations, home glucose readings, urine tests, vet checks, helps the vet fine-tune the insulin dose over time.
Fine-tuning that dose sounds tricky. You mentioned DKA. If blood sugar is too high. But what about the other way? Is there a risk of giving too much insulin?
Absolutely. That's a really important point the sources raise, and something owners need to be vigilant about. Too much insulin causes hypoglycemia, dangerously low blood sugar.
And that's also an emergency.
Yes, it is. It can happen if maybe the pet doesn't eat its full meal but gets the usual insulin dose, or if the dose is just too high. Signs are things like weakness, trembling, maybe acting disoriented or drunk, progressing to seizures, or even coma if not treated fast.
What should an owner do if they suspect that?
Immediate action is needed. Rubbing something sugary like corn syrup, honey, or glucose gel directly onto their gums can help raise blood sugar quickly, and then get straight to a vet. They might need intravenous dextrose.
Okay, so managing diabetes is this careful balance, avoiding the highs that lead to DKA and long-term complications, but also avoiding the lows of hypoglycemia. It really underscores the partnership with the vet and the owner's role.
Exactly. It's about consistency, observation, and communication.
We've touched on complications like DKA and hypoglycemia. Let's just quickly recap the main ones the sources mentioned that can occur if diabetes isn't well managed over the long term.
Sure. The big ones we've covered are hypoglycemia, the low sugar emergency, and DKA, the high sugar ketone emergency. Then specifically for dogs, cataracts are very common and can cause blindness, though surgery is sometimes an option. And for cats, that neuropathy, the nerve damage affecting their hind legs and gait, is a notable potential complication.
Right. So given these potential complications and the need for ongoing management, what's the outlook? What do the sources say about the prognosis? Is a diabetes diagnosis, a death sentence?
No, absolutely not. That's a key message from the sources.
Yeah.
While it's definitely a serious condition requiring lifelong attention, especially for dogs,
Right.
with diligent care, meaning that consistent routine, the right insulin, the right diet, regular monitoring, and working closely with the vet, most diabetic pets can live long, happy, good quality lives for many years after they're diagnosed.
That's really reassuring.
It is. And again, that key difference. Dogs usually need insulin for life. Cats might achieve remission, especially if diagnosed and treated aggressively early on. But even for those needing lifelong care, the prognosis is generally good with commitment.
Okay. So wrapping this deep dive up, what have we learned from your sources? We've seen diabetes is about the body's struggle with glucose and insulin. We know there are risk factors like genetics, obesity, other diseases. We know the key signs, those Ps, plus weight loss. We know how vets diagnose it with blood and urine tests. And we know management is this combination of insulin, diet, exercise, and careful monitoring. It sounds like a lot, but the message seems to be, it's serious, yes, but absolutely manageable with dedication.
That's exactly it. The core message really boils down to vigilance, paying attention to your pet, and partnership with your vet. Noticing those early, maybe subtle changes in drinking or peeing or appetite can kickstart everything. It does take a significant level of commitment and involvement from the owner, day in, day out, but seeing your pet thrive despite the diagnosis is incredibly rewarding.
And it really is fascinating how far things have come. The tools, the knowledge, the specific diets, the monitoring options, they all exist now to help these pets live really well.
It's true. And thinking about that daily commitment, that diligent care we keep mentioning, it brings up a deeper question, maybe for you listening to think about. Beyond the clinical steps, the shots, the food measuring, what does that diligent care truly mean in the context of the life you share with your pet? How does that relationship, the bond between you and your animal, potentially shift or deepen when you become partners in managing a chronic condition like this together?
That's a powerful thought to end on, something to definitely reflect on. For now, take this knowledge, observe your own pets, and remember that being aware is the first, most crucial step.